Hi, I'm Dr. Samuel Seward. I'm here with Christina today to talk about HPS.
What is HPS and how do you get it?
HPS is Hermansky-Pudlak syndrome, and it's a congenital disorder, meaning something you're born with, and it's autosomal recessive.
What are some signs and symptoms of HPS?
The classic ones that for a lot of people they'll be there right from birth is that you're albino, so you're much fairer than your parents or your sisters or brothers a lot of times, and that the albinism is also in your eyes. So frequently you also have really decreased vision, sometimes legal blindness. And then the other thing we often see even in very young people is problems with bleeding and easy bruising.
Does everyone experience the same symptoms in the same way?
Definitely not. And one of the interesting things is even for an individual with HPS, the symptoms they can experience throughout their lives can change. So a lot of times people will have very easy bruising when they're young, and as they age, that can change. The degree of pigment they have in their hair can change as they get older, and things like that. And certainly one person to another, how they experience the symptoms and what the symptoms actually are can be different in severity. But we always expect to see albinism. We always expect to see some degree of a bleeding disorder.
What can be done to correct the vision?
Well, people that have HPS, back when they were in their mother's wombs, during embryological time of their lives, certain things did not happen in their eyes that would allow them to have normal vision. So you can never really correct a person with HPS vision back to normal. But there's lots of good sort of equipment that people can use. There's contact lenses as well as glasses. There are monocular devices that are used for looking at printed pages. There's lots of good assistive technology available now on computers that can help people with HPS and visual impairment do what they need to do the things they want to do in their lives.
What can be done to treat the bleeding problems?
Well, there's a lot of good sort of practical things that people can do just to sort of avoid, particularly for things like the nose bleeding that people will experience, keeping the membranes of the inside of the nose well moisturized in the wintertime, using a humidifier in their rooms, being careful about trauma. So we will generally say, think twice about whether you want to do contact sports because you do have a bleeding disorder. And then for women, as they get into the time when they start first having their periods, we'll usually talk to people about whether they might consider using oral contraceptive pills, not necessarily for contraception, but actually because it can help moderate some of the bleeding that they have from that.
So how do you know if bleeding is bad enough to seek medical attention?
We will generally say, for example, with nosebleeds, if people have bled from their nose more than 30 to 45 minutes, they've used all the normal things we would recommend, like pressure and a cold compress, and the bleeding is still continuing, they probably should seek medical attention at that time. For women, we'll say if they've used typically more than 8 pads in one day, or certainly if they're having any symptoms like they're feeling dizzy when they stand up suddenly, or they're feeling weak or excessively tired, then that too is a time when they should seek medical attention. In the context of people that need surgery, we always feel that they should have that surgery only when they first gotten advice specifically related to their bleeding disorder. And we'll recommend things like there's a drug called DDAVP that we can give either intranasally or intravenously. Sometimes we'll give people normal platelets to help them not bleed after they've had a surgical procedure. And we like people to think about, well, what would happen if you were in a car accident and someone didn't know that you had a bleeding disorder, and therefore we like people to think about having things like medical alert bracelet so that doctors that are taking care of them can be alerted to this problem.
What are some symptoms of the bowel problems associated with HPS?
Well, it's a type of inflammatory bowel disease. So the classical symptoms that people will experience, which are very difficult, but are severe abdominal pain or cramping, fever, and bleeding. Bleeding in their stool, bleeding from their bottoms are the ones that people experience. Along with those symptoms, people have a lot of weight loss. They can't keep their weight on very well. Sometimes they'll have difficulty absorbing certain nutrients from their food because of the inflammation in their bowels.
So what sorts of problems do women with HPS experience uniquely?
Well, I mentioned the bleeding disorder that women experience around menstruation, and just to talk a little bit more about that, sometimes it can be really socially isolating for them. I've had patients that because their menstrual periods are so heavy, they'll stay home or they'll call in sick to work. And we really feel those kinds of symptoms we can help them manage by considering things. I mentioned oral contraceptives. There's also other things we can consider to help with that. Women, when they get to be at the time of their lives when they're thinking about pregnancy, should certainly go into their pregnancy from a bleeding perspective, knowing that we can help them manage the delivery, but they are at increased risk for bleeding around delivery, and that too is a place where they should have close, well-informed medical care around the time of delivery of their babies.
What are some of the symptoms of lung disease and HPS?
The lung disease that patients with HPS get is called interstitial lung disease, and it's the type of ILD is pulmonary fibrosis. And the classical symptoms are a dry cough, meaning you're not producing a lot of sputum. And then the other one is you get short of breath when you exercise, and sometimes we call that dyspnea with exertion. And the shortness of breath tends to progress over time, so that when you talk to people with this problem, they'll tell you, I'm more short of breath this year than I was last year, and they'll be able to tell you, I used to be able to run up 3 flights of stairs in my office or at home, and now after 1 flight of stairs I've got to stop because I'm so short of breath.
What can be done to treat the lung problems?
Unfortunately, currently there's no FDA-approved treatment for the lung disorder. There are lots of treatments that doctors and researchers have tried over the years, and so far none have been shown to be beneficial for everybody with pulmonary fibrosis. But we're very hopeful about things that are in the pipeline now. There's some very important research being done at the National Institutes of Health, particularly for the lung disease, and we're hopeful within, let's say, years that there will be treatments that are available to people. Apart from drugs, there is the opportunity for some people, as their lung disease advances, to consider being seen at a lung transplant center for transplantation of the lungs. And pulmonary fibrosis is an indication for lung transplantation.
What else do you think someone new to HPS should know about the syndrome?
Well, as I would say to any patient of mine, I think there's a lot of things about just living that one can do from oneself just to live healthfully. So things like getting all of your vaccinations as a child, and we'll generally recommend that people, after they get a vaccination, that the site be iced for about 15 minutes. But all the routine pediatric vaccinations are important. Eating healthfully, getting regular aerobic exercise that's good for your lung and your heart. Just living healthfully is going to be good. Taking care of yourself emotionally, having people in your life that care about you and that can support you are all very important things for someone with HPS. I mentioned earlier we'd like to encourage people with HPS to wear a medic alert bracelet or a necklace. If they're in a place where they need medical attention, it's important that the people that are taking care of them have these basic pieces of information about their disorder. We encourage people to try to find doctors and other healthcare providers that know about HPS, but also recognizing that it's so rare that sometimes the people that have HPS have to be involved in educating their healthcare providers about the disorder.
Thank you.
You're welcome.